All right, guys, let's talk hair transplants and some of the questions that you've been asking. So first and foremost, will a hair transplant suit me? Look, the simple answer to that is, yeah, pretty much everyone can get a hair transplant. The simple science and medicine behind it is that you take hair from the back and sides of the head and transplant them onto the top of the head or wherever the hair loss may be. If you want to understand a little bit more about why that process works, quite simply, in male pattern baldness in particular, the reason men go bald is because of a substance that we have in our bodies called DHT, and there is an abundance of DHT in the top of our heads. Now, the reason the hair falls out is because a lot of these hairs are sensitive to DHT, and it essentially just makes them dislike where they live, and they decide to leave. They fall out, so you go bald. Now you might ask, okay, so why does that happen to the top of your head and not to the side of your head or to your body? Like in my case, I've got hair on my shoulders and God knows where else. The reason the hair on the back of your head and the sides don't fall out is because for some reason those hairs are DHT resistant. So even though there is DHT, they just seem to not really care as much, and then they don't fall out. So the simple science behind a hair transplant is that if you take hairs from the sides and back of your head, those hairs are DHT resistant, so then when you put them into the top of your head, even though there is DHT, they simply don't care, so they survive. The next question is, will hair transplants give me a full head of hair? I get this a lot, and you know it's phrased in different ways, but essentially that's one of the biggest questions that people want answered. What is a hair transplant going to look on me? There is no simple answer to this, guys, and I want you to understand that a lot of places now are giving guarantees and giving prices based on the number of grafts and the number of transplants, the number of hairs, whatever any of that means. If places are talking to you in that way, look, you know, the simple answer would be run, but not to use scare tactics. I'd just be a little bit apprehensive around that sort of advice. Quite simply, it's really difficult to tell someone what their final result is going to be. There's so many factors that affect that, and also the number of hairs that you're going to get transplanted. It's really hard to give a firm number, and there's a couple of really simple reasons for that. So when you take the hairs from the back of the head and you take a single hair follicle, just because you've taken a single hair follicle doesn't mean that that's one hair. So within that, there can be one hair, there can be two hairs, there can be three, there can be 4 or 5 hairs in that one follicle, right? So for instance, when I did my first hair transplant, luckily enough, the hairs on the back of my head were a majority of 2, 3, and 4 hair follicles. So even though I might have had 2,000 transplants, out of those 2,000 transplanted grafts, there might have been 4,000, 5,000 hairs, because some of those grafts had 1 hair, 2 hairs, 3 hairs, whatever. The caveat to that is you do need some single hair grafts, because the frontal hairline needs to be made with single hairs so you get that natural look. When people get that patchy look, that sort of looks like the old the grass that we used to plant back in the day in the little squares, that's because they've been transplanted with multiple hair grafts in the frontal hairline. That's a big no-no. So if anyone's doing that, please make sure you don't allow them to. Frontal line has to be single hairs. In terms of the success rate for a hair transplant, another one that we get asked so often, you know, what are the chances, what's the likelihood of my hair transplant being successful? Look, in any medical procedure, there are obviously risk factors. I have had 3 hair transplants now, and every single one of them has had different post-operative instructions, some very loose, some very stringent, and I have never had a problem regardless of the post-hair transplant instructions that I was given. What I will say is that a lot of the success comes down to the skill of the hair transplant surgeon, or more often than not technician or practitioner, and realistically, the more practice they've had, the more hair transplants they've done, the better the outcome's going to be. What's really, really important in a hair transplant is getting that natural look, and depending on the angle at which the hair goes in, the type of hairs that they use, the type of equipment that they use, so how big those holes are going to be in the transplanted area, that can make a really, really big difference in the finished product or the success of the hair transplant.